Hello everyone. Now we will discuss about the somniferous poisons. Okay. The first one is the opium. Opium is derived from the papaver somniferum. The common name for opiums are poppy, afim, kasumba or madak chandu. Okay. The active principles present in the opium are, there are two types of active principles. The first is the phenanthrines, that is morphine, which is 10%, then codeine 0.5% and thebaine 0.3%. These are all narcotics. Okay. And the second type of active principles are benzyl isoquinolone. Okay. Examples are papaverine 1% and noscapine 6%. They have mild analgesic but no narcotic properties. Now we will see some images. Okay. The first one, this image is of the poppy seeds, also known as khaskhas. These are white, harmless, demulcent and nutritive, have nutritive value and are used as food. Okay. So this is the capsule of the opium or poppy. This is an unripe capsule which is incised and the white juice is collected and allowed to evaporate to obtain opium or afim. Ripe and dry poppy capsules, they contain a trace of opium and are used for their sedative and narcotic action. See, this is how the cuts are made to collect the milk and they are dried in this form. This is afim. Okay. Another diagram, this is the flower of a opium. Okay. Now we will learn about the classification. Okay. The first one is the natural, that is morphine, codeine. Okay. Now the second type is a semi-synthetic. Substances which are derived by modification of chemical constituents of opium are called semi-synthetic narcotics. Okay. The examples are heroin, hydroxymorphone, oxymorphone and oxycodone, etc. Okay. And the third one are called the synthetic drugs. They are also called as designer drugs. They are highly potent and addictive. Examples are meperidine, methadone, fentanyl, propoxyphene or levorphenol tartrate. Okay. The fatal dose of various drugs are opium, it is 2 gram. For codeine, it is 0.5 gram. For methadone, it is 100 gram. For morphine, it is 0.2 gram. For propoxyphene, it is 1 gram. And for pentazocine, it is 300 milligram. Okay, and the fatal period is within 6 to 12 hours. Now we will learn about the signs and symptoms of opiate poisoning. Okay, the symptoms include the classic triad of respiratory depression, pinpoint pupil and impairment of sensorium, out of which respiratory depression is the most common feature of opium poisoning. Okay. Now, there are three stages. The first stage is the stage of excitement. There is increased sense of well-being, euphoria, hallucination, flushing of face, and the person is greatly excited. Then the second stage is the stage of stupor, which contains headache, nausea, drowsiness, strong tendency to sleep, from which patient can be aroused by painful stimuli. Pupils are contracted, face and lips are cyanosed, pulse and respiration are normal. And the third stage is of stage of coma. All reflexes are abolished, all the secretions are suspended except sweat. Perspiration is very much increased. We will learn about the different detection tests. Okay. The first one is the Marquis test, in which there is 3 milliliter of concentrated sulfuric acid is used with 3 drops of formalin and the suspected sample is added. The substance turned purple red color into violet. Okay. Now the second test is the Mandelin test. In this the reagent is the ammonium vanadinate in concentrated sulfuric acid. Okay. Now the different substances produce different characteristics color changes. Okay. Like the morphine produce blue gray color, codeine produce olive color, heroin produce brown color and methadone produce green to blue color. And the third test is the microcrystalline test. It is a very precise test which is based on their crystalline structure. Okay. Now we will learn about the treatment part. The first one is the gastric lavage, as you already know, like 1:5,000 potassium permanganate solution is used. Okay. The second one is the naloxone hydrochloride. It is the specific opioid antagonist. Okay. 2 milligram is given intravenously. And nalmefene has longer duration of action effect than the naloxone. Okay. Now what is coma cocktail? We have learned previously also, that is in comatose patient where identity of poison is not known, 100 milliliter 50% glucose, 100 milligram thiamine and 2 milligram naloxone is given IV. Okay. So this is the coma cocktail. Now we will discuss about heroin, that is brown sugar or diacetyl morphine. Okay, there are three types of heroin, that is white, brown and black tar. Okay, it is the most dangerous among all drugs of addiction. It is not taken orally because it is rapidly hydrolyzed in the stomach. It is taken by dissolving in liquid and then heating it on a foil paper, and then smoke or vapor is inhaled, which is called as the chasing the dragon. Okay, now what are speedballs? Speedballs are the combination of cocaine and heroin which are taken for a better head. Okay, now it can cause sudden death even in person who have been using it for some time. The treatment is methadone is given 40 milligram daily. Okay, we will talk about meperidine or pethidine. Its addiction is common among doctors and nurses, and its action is same as that of morphine.